Welcome to today's video about 10 symptoms of fatty liver. Are you feeling tired all the time, experiencing abdominal pain, or noticing unexplained weight loss? These could be symptoms of a condition that affects millions of people around the world. Fatty liver disease. Fatty liver occurs when there's a buildup of fat in the liver cells, leading to inflammation and damage. This damage can result in serious complications, including liver failure, liver cancer, and even death. But the scary thing is, many people don't even know they have a fatty liver until it's too late. That's why it's important to know the 10 symptoms of fatty liver that you should watch out for. In this video, we're going to explore the signs and symptoms of fatty liver and the serious consequences that come with this disease. So buckle up and get ready to learn everything you need to know about fatty liver disease. Don't miss out on this important information that could save your life. Let's start our countdown with number 1, fatigue. Fatigue is a common symptom associated with fatty liver. This is because the liver plays a crucial role in metabolizing toxins and producing energy. When the liver is overloaded with fat, it may not function properly, leading to feelings of fatigue and sluggishness. Recent scientific research has shed some light on the link between fatty liver and fatigue. A study published in the Journal of Hepatology in 2020 found that fatigue was more common in people with non-alcoholic fatty liver disease than in those without the condition. The study also found that fatigue was associated with a higher severity of NAFLD and a greater likelihood of developing advanced fibrosis. The researchers suggested that the underlying mechanisms of fatigue and NAFLD may be related to inflammation, oxidative stress, and altered gut microbiota. They also highlighted the importance of diagnosing and managing fatigue in people with NAFLD, as it can significantly impact their quality of life and overall health outcomes. Next, number 2, abdominal discomfort. Abdominal discomfort is a common symptom associated with fatty liver. This discomfort can range from mild to severe and is often felt in the upper right side of the abdomen, where the liver is located. The discomfort may be accompanied by bloating, nausea, or a feeling of fullness. Recent scientific research has shown a strong correlation between abdominal discomfort and fatty liver. In a study published in the Journal of Gastroenterology and Hepatology in 2021, researchers found that patients with fatty liver disease were more likely to experience abdominal pain than those without the condition. The study also showed that the severity of the abdominal pain was directly related to the degree of liver fat accumulation. It's important to note that abdominal discomfort can also be a symptom of other liver conditions, such as hepatitis and cirrhosis. Therefore, it's crucial to seek medical attention if you are experiencing abdominal discomfort, especially if it's accompanied by other symptoms such as fatigue, poor appetite, or jaundice. Next, number 3, poor appetite. Poor appetite is a common symptom of many conditions, including fatty liver disease. When someone has fatty liver disease, their liver accumulates too much fat, which can cause inflammation and damage to the liver. Over time, this can lead to more serious liver conditions such as cirrhosis or liver cancer. Poor appetite can be a symptom of fatty liver disease because the liver plays a key role in regulating appetite and metabolism. Recent research has shown that there may be a link between poor appetite and the progression of fatty liver disease. A study published in the Journal of Clinical Investigation in 2021 found that mice with fatty liver disease who were fed a high-fat diet experienced changes in their gut microbiome, which led to a decrease in appetite and worsened liver function. This research highlights the importance of a healthy gut microbiome in maintaining liver function and appetite regulation, particularly in those with fatty liver disease. Next, number 4, weakness. Firstly, weakness can be a symptom of a variety of different conditions, including but not limited to anemia, thyroid disorders, heart problems, and even simply not getting enough sleep. In some cases, weakness may also be a symptom of fatty liver disease, which is a condition where there is an accumulation of fat in the liver. In recent years, there have been a number of scientific studies looking at the link between fatty liver disease and weakness. One study published in the Journal of Clinical Endocrinology and Metabolism in 2019 found that people with non-alcoholic fatty liver disease were more likely to experience muscle weakness than those without the condition. The researchers suggested that this may be due to the fact that fatty liver disease can lead to insulin resistance, which in turn can cause muscle weakness. Next, number 5. Spider angiomas. Spider angiomas are small, red, spider-like blood vessels that appear on the skin surface. They are often found on the face, neck, chest, and arms, and they can be an indicator of liver disease. The appearance of spider angiomas is thought to be related to elevated levels of estrogen, which can occur in people with liver disease. Recent scientific research has found a connection between fatty liver and spider angiomas. A study published in the journal PLOS One in 2019 found that the presence of spider angiomas was strongly associated with the severity of fatty liver disease. The researchers analyzed data from over 400 patients with fatty liver disease and found that those with spider angiomas had more advanced liver disease and were more likely to experience liver-related complications. These findings highlight the importance of monitoring spider angiomas as a potential indicator of liver disease, particularly in patients with known risk factors such as obesity and alcohol consumption. If you notice any new spider angiomas or other skin lesions, it's important to bring them to the attention of your healthcare provider so that they can be properly evaluated and treated if necessary. Next, number 6. Jaundice. Jaundice is a condition that occurs when there is a buildup of bilirubin in the blood. Bilirubin is a yellowish pigment that is produced when red blood cells are broken down. Normally, the liver removes bilirubin from the blood and excretes it in the bile. However, if the liver is not functioning properly, bilirubin can build up in the blood and cause yellowing of the skin and eyes, as well as other symptoms such as fatigue, nausea, and abdominal pain. Recent scientific research has shown that there may be a link between these two conditions. A study published in the Journal of Hepatology in 2019 found that patients with fatty liver disease were more likely to develop jaundice than those without fatty liver disease. The study also found that patients with more severe fatty liver disease were at a higher risk of developing jaundice. These findings highlight the importance of early detection and treatment of both jaundice and fatty liver disease. If you are experiencing symptoms such as yellowing of the skin or fatigue, it is important to consult a healthcare provider to determine the underlying cause and develop an appropriate treatment plan. Next, number 7. Elevated liver enzymes. Elevated liver enzymes are a common indicator of liver damage or disease. These enzymes are produced in the liver and help to metabolize fats, proteins, and carbohydrates. When the liver is damaged, these enzymes can leak into the bloodstream, causing their levels to rise. Recent scientific research has shown a potential link between elevated liver enzymes and an increased risk of developing fatty liver disease. In a study published in the Journal of Gastroenterology and Hepatology in 2021, researchers found that people with elevated liver enzymes were more likely to have fatty liver enzymes, even if they did not have any other risk factors such as obesity or diabetes. The study also found that people with elevated liver enzymes who had fatty liver disease were more likely to develop liver scarring and cirrhosis than those without fatty liver disease. This highlights the importance of monitoring liver enzyme levels as a potential early warning sign of liver damage and disease. Next, number 8. Insulin resistance. Insulin resistance is a condition in which cells in the body become less sensitive to the hormone insulin. This leads to elevated levels of insulin in the blood, which can contribute to a number of health problems, including type 2 diabetes, high blood pressure, and fatty liver disease. Recent scientific research has shed new light on the link between insulin resistance and fatty liver disease. A study published in the journal Diabetes Care in 2020 found that insulin resistance was a major risk factor for the development of non-alcoholic fatty liver disease, a common form of fatty liver disease that is not caused by alcohol consumption. The study also found that individuals with insulin resistance and NAFLD had a higher risk of developing advanced liver fibrosis, a serious complication of fatty liver disease. These findings highlight the importance of maintaining healthy insulin levels and avoiding insulin resistance through lifestyle factors such as regular exercise and a healthy diet. Next, number 9. Increased abdominal fat. Increased abdominal fat and fatty liver are two conditions that often go hand in hand. This condition is commonly associated with obesity, insulin resistance, and metabolic syndrome, Recent research has highlighted the link between increased abdominal fat and fatty liver disease. One study published in the Journal of Hepatology in 2020 found that excess visceral fat was strongly associated with the development of non-alcoholic fatty liver disease, a condition in which fat accumulates in the liver in the absence of alcohol consumption. The study also found that people with higher levels of abdominal fat were more likely to experience inflammation and scarring in the liver, which can lead to more severe liver damage over time. So, increased abdominal fat and fatty liver are both linked to a higher risk of health problems. It's important to maintain a healthy weight and lifestyle to reduce your risk of developing these conditions. Next, number 10. Dark urine. One of the symptoms of fatty liver disease is dark urine. This happens because the liver is responsible for processing bilirubin, a waste product produced when old red blood cells are broken down. In cases of fatty liver disease, the liver may not function properly, and bilirubin can build up in the bloodstream, leading to dark urine. It is important to remember that fatty liver is a serious condition and should be treated by a medical professional. If you are experiencing symptoms of fatty liver such as dark urine, it is important to seek medical attention as soon as possible. Well, that's it for today's video on the 10 symptoms of fatty liver. We hope you found this information useful and informative. Remember, a fatty liver can be prevented and treated with lifestyle changes like a healthy diet and regular exercise. If you're experiencing any of the symptoms we discussed, it's important to speak with your healthcare provider for proper diagnosis and treatment. If you like this video, be sure to give it a thumbs up and subscribe to our channel for more informative content like this. And don't forget to hit the notification bell to stay up to date with our latest videos. Thank you for watching, and we'll see you in the next one.